Good afternoon, welcome again to this health series, and today we are talking about combined oral contraceptives. Okay, this is part 2 of this video. If you've not seen the first one, check up there, you will find it. So guys, today I want to tell you about COCP, okay, because it is common, it is very common. In Nigeria, you can get it over the counter. Outside Nigeria, I do not know, so I don't think you can get it over the counter, but you should be able to do that. And that's why I need to tell you, because many of us women, we take these medications without knowing the side effects, without knowing if we are permitted to take them, without knowing that if they can hurt us, okay? And there are particular set of people that should not take COCP because it can really hurt them, okay? And what I mean by hurting them is that they can develop a side effect that they wish they never even took the drug, okay? Combined oral contraceptive pills, they are pills and medication that you take. Some people take it for 21 days and then have 7 days of break. During that 7 days they can bleed, okay? There are other ones that people can just take. They take different medication for 21 days and then continue for the next 7 days, still part of the pill, all right? And combined oral contraceptive, like the name sounds, it's made up of estrogen and progesterone, all right? And so the way it works is that it prevents you from ovulating, it prevents you from releasing an egg, so you're not ovulating. And also it makes the cervical mucus very thick, so the sperm cannot enter. It thins the wall of the womb so that there is no implantation. So you see that this is the way it works, and it's very good because if 100 people are taking it correctly, the right way, less than 1 person among 100 women taking this medication will get pregnant. That's how effective it is, okay? However, there are side effects and there are people that should not take it. I will come to that towards the end of this video. Also, it's very good because if you have dysmenorrhea, menstrual pain, for instance, I used to have menstrual pain, like severe menstrual pain, and I think I was doing my elective program in a hospital here in UK sometime, and then the gynecologist, the consultant, asked me, "You're not fat, you're not smoking, you don't have any risk factors, why not take combined oral contraceptive and forget your period?" That is just to tell you that when you take this medication, you can basically forget your period, but there can be occasional bleeding here and there, or even if you bleed, you're not ovulating to get pregnant. So you see, it's good for people that have dysmenorrhea, people that have severe menstrual pain. It's also good for them. People that they don't want to get pregnant and they know that they can keep to the medication, it's also very good for them. However, there are a group of people that should not take this medication, which I will tell you now. 1, people with migraine with aura. And one thing you have to know, migraine is very common. You know what is migraine basically? We can talk about it in our next video. They should not take combined oral contraceptives. This is because their risk of having a stroke is increased 2 to 3 times compared to other people who do not have migraine and taking this medication. People who are older than 35 years and they smoke, you understand, they should not take combined oral contraceptive. There are people that they may not. If the people, to anyone that is obese, that one, it's not there, but you have to weigh your options. So before you start taking this medication, you need to talk to your doctor. I am saying this thing because it's a common drug and people take them without knowing the risk factors or the things that are associated with it. People with hypertension that is not controlled are not supposed to take this medication. Have you learned something today? Follow this page for our next video. In my next video, depending on what you want, I may be telling you how the correct way to take combined oral contraceptives, but for sure I'm going to tell you about dysmenorrhea, menstrual pain, the things you can do, okay? So follow our page for our next health video. Did you learn something today? See you in my video, guys. Now, if you watch this video to the end, I want you to tell me what you learned from this video, or what kind of video you want me to talk about in my next video. Say it in the comment section and I will see you. Take care, guys. Bye-bye.